So when we're taking a look at our shoulder joint, there are two bones that make up the shoulder joint, which is also known as the pectoral joint or the pectoral girdle. So the two bones are going to come together kind of in this way. So we're kind of looking at the lateral side. This is the medial side. So this bone here is in the front. This is the clavicle. So we have this kind of rounded end. That's the lateral side of your shoulder. This part here is the one that's going to articulate with the sternum. So this is just the clavicle. Nothing really major to know on that other than it's clavicle. This is the scapula. So if you're looking at somebody and looking at them from the back, this would be the right scapula. So this area here is going to be lateral. This area here is going to be medial. You guys probably know it as your shoulder blade. So a couple of things that you're going to notice right off the bat is this bone has this very large thing right here. Okay, it's very big. This is called the spine of the scapula. The spine of the scapula is going to end in what's known as the acromion process. So this up here is called the acromion process, sometimes just shortened to acromion. When you look at this area here, if you turn it so you're looking at it laterally, you'll notice that there's actually two projections here with this thing in the center. So this is the acromion. It's coming off of that spine. And then this thing here is the coracoid process. Okay. In between, we have this little flattened area. If you guys know your shoulder is a ball and socket joint, that socket is the glenoid cavity. So this thing here is that glenoid cavity. So the next couple of structures are fossas. Fossas are these basin-like depressions. And so when you look at these things, you're going to notice it's not exactly, and if I kind of turn it to the side, you can kind of see there's some bumps and some grooves. So the first one is known as the infraspinous fossa, and that's kind of where my hand is here. So the infraspinous fossa, infra referring to the fact that it's below, spinous referring to the fact that it's below the spine of the scapula. So the infraspinous fossa is here. The supraspinous fossa is here. So supra referring to the fact that it's superior, spinous referring to the fact that it's above the scapular spine. So the supraspinous fossa is here. Right next to it, you'll notice this notch right here. This is the suprascapular notch. Suprascapular, supra, the superior part of the scapula, and it's a notch. You can see that there's a piece that looks like it's been taken out of it. The last part that you need to know is the subscapular fossa. So the subscapular fossa is actually on the anterior portion. So this area right here, this indentation, is that subscapular fossa. Once again, you can see the suprascapular notch. You can see the coracoid process from the anterior aspect of the scapula.